Hello everyone. I would like to introduce to you Group 4. Kimberly Belmonte, Suneta Mudiazalaj, Rama Kadal, Pradeep Panech, Marian Joyce Serrano. In this presentation, we will be presenting to you the Candid family. Part of this presentation is the story of family Candid and the problem of the family genogram. This tool helps us to understand the representations of families that start with a family tree using a graphical structure including the details regarding the structures of the family, cohesiveness or conflicts, timelines of events, patterns of family. EcoMap was used not just to understand how each family member related to one another but also to the community around them. These therapeutic questions help us to present to the family with the right manners, build trust and respect from one another. The list of psychosocial considerations that we had identified, the list of commendations that may help to address the problem of the Candid family, also, our plan of care for the family. Presenting to you the story of the Candid family. Mr. Mike Candid is 43 years old, healthy, non-smoker, works full-time as a machine operator in an industrial company, night shift, and drinks alcohol occasionally. Mike was born here in Canada. Mrs. Ann Candid is the wife of Mr. Mike, 41 years old, healthy, and has no morbidities, and does all the household chores and takes care of her mother. She also does a part-time job. Anne was born in Ukraine and migrated to Canada when she was 4 together with her parents. Anne was the only daughter of Rose and her father died 5 years ago with stage 4 liver cancer, type 2 diabetic mellitus, and complication of myocardial infarction. Her father died at the age of 87. Mr. and Mrs. Candid have 3 children. All their kids were born in Canada. Andrew is 17 years old, studies in grade 12, healthy, loves being around people, very responsible elder brother, and is loved by their neighborhood. Carla, 14 years old, is their second child and oldest daughter. She is in grade 8, healthy, very active in school activities and in class. Fiona, 8 years old, is their youngest child, in grade 3, healthy and loving. Mrs. Rose, 87 years, an elderly widow, mother of Anne. She has a history of diabetes and hypertension, managed well via routine medications. She was recently diagnosed with an early onset of Alzheimer's disease. The Candid family lives in their own house with 3 children. The mother of Mrs. Candid also lives with them in East York, Ontario. This family belongs to an extended family. The family Candid are Christian. They can be described as a harmonious family in the best scene. They love spending family time together, especially on weekends. They make sure that they eat dinner together. They were a happy family. They belong to the core of Ukraine. Mrs. Rose was rushed to the hospital because she suffered a second-degree burn while Anne is preparing food for dinner.
Hi. My name is Anne, the daughter of Mrs. Rose who was just rushed to this hospital.
Hi Mrs. Anne, my name is Rena, the nurse of your mother. Your mother suffered from a second-degree burn on her right arm and shoulder, abdomen, and some part of her thigh. She is being treated now. I have some questions about Mrs. Rose. Is it okay if I ask you before I bring you to your mother?
Of course.
Come with me. Before I proceed, how would you like to be addressed?
Anne is fine.
Anne, can you tell me what happened?
I was busy preparing dinner in the kitchen, and I didn't notice that my mom is in the kitchen too making her tea. When I heard her scream and found out that she burned herself with boiling water, I got panicked and rushed to help her. I called 911 for help and they helped me to give my mom first aid for her burn. After 10 to 15 minutes the ambulance came and rushed her here. When the ambulance left I call Angeline right away, who is my best friend since we were in high school. She came right away and drive me going to this hospital. I am so worried about my mom.
Is this the first time she injured herself?
That's why I am getting worried because of her mental condition. She has been frequently rushed to the emergency suffering from minor injuries. I think her Alzheimer's is getting worse. Because she is sometimes confused with hot and cold, morning and evening. Sometimes she gets upset and says that she has no taste of any foods she is eating and asks questions repetitively regarding the same things. Misplace her items and forget the places and objects. Also, because of my mom's frequent hospitalization and her health condition is getting worse, I become inattentive with my husband and kids. One of my daughter's grades in her classes is dropping. Fiona's, my youngest daughter, become aloof with her classmates and friends. My kids are now fighting with one another with simple arguments. Mike has been busy working overtime to provide for and support our family's financial needs.
I understand. How are you feeling right now? How is your mother doing on a daily basis?
She walks very slowly now. I always assist her with activities of daily living. She has been starting to wander, her forgetfulness is increasing. Sometimes she has no appetite for food, her emotion is labile. She seems disoriented sometimes. Also, there were times that she has no balance and that caused her to fall.
Are there any traditional practices or beliefs you and your family need to be noted for the plan of care for your mother?
No. We don't have any.
How about any herbal medication?
We only take medications if it is prescribed or recommended by the doctor.
Does Mrs. Rose have any known allergies?
None that I am aware of.
Is she taking any medication?
Yes, I brought with me all her daily medications and prescriptions. Here.
Perfect. Thank you. Also, according to her chart, her BP is 138/100 mmHg and her blood sugar is 4.8 mol. Thank you for all the information, and let us now go and see your mother.
Hi, Mom. How are you feeling now?
What happened? I feel so in pain.
You just had an accident in the kitchen. You burn yourself. We are in the hospital. The doctors and nurses are treating you now. This is Nurse Rena, the nurse that takes care of you.
Hi, Mrs. Rose. How are you feeling now?
Hello, I am in so much pain and I don't remember why I am here. I wanna go home now. When can we go home? I wanna help my daughter, she is busy cooking for dinner.
I understand. But you still need to stay here at the hospital for a few more days so we can continue to treat your burn.
No worries, Mom. I am here. If you need anything, just let me know. Mike and the kids will be here soon. You should go and rest in the meantime.
Okay. Thank you.
That's perfect. If possible, can I talk to you with your husband and children to further discuss options to help you and your family in this kind of situation?
Sure. Let's go. See you later, Mom.
This is great that all of you are here. And mentioned a while ago about your family's current situation. It is important that we discuss this together with your family so everyone can understand and help each other.
I'm so exhausted with my life. We are facing a lot of problems. I could not give time for my husband, children, and myself. Is this my life? I never expected the horrible situation that we are experiencing right now. I'm so unlucky.
Yes, I can understand this is a hard time for you and for your family. You have been doing good for your mom and for your family. I can see you are a caring daughter, wife, and mother in your family.
I was, but now I couldn't give time to my family. I'm tired and exhausted. I am unable to manage everything in my family along with my part-time job. My mom needs 24 hours supervision. My children are experiencing a wide range of emotions. They are fearful. They also don't know and understand what is going on with their grandmother.
I'm so sorry, Anne. I didn't realize these things and couldn't help to spend time with you and the kids. We have a lot of expenses right now and I was working extra hours to manage the expenses of our household.
Mike, you have been doing great for your family. You are working so hard to provide for the financial needs of your family. Kids, have you ever heard about Alzheimer's disease?
Yes, I read somewhere about it and it is a forgetfulness disease. Mom, I'm so sorry you were going through a difficult situation. I can help my sisters with their homework, and I can drop in and pick up Fiona from school.
That's great, Andrew. You are an amazing son. Yes. You are right. It is a forgetfulness disease in old age. Alzheimer's disease commonly starts after 65 years old. There is a correlation between high blood pressure, diabetes, and Alzheimer's disease. Your grandmother has had diabetes and hypertension for 10 years, which was under control. Alzheimer's disease doesn't transfer from person to person, so you don't have to be worried about it. Your grandmother doesn't remember as normal people do. It is essential that you help and support her in this process.
Now I understand why my grandmother was like that. I'm sorry, Mom, if we were not able to cooperate with you. I can help you with household chores and look after grandmother during our free time.
That's great, Carla. CN, you are such a lucky mother to have these loving and caring kids. Have you ever consulted with a social worker regarding your mom's care?
My friend Angeline had given me the contact number and address of the social worker, but I never had a chance to meet with them. Do you think they can help me in taking care of my mom?
Yes, the social worker can help you to find some source and organization to provide care to your mom, like 2 to 3 hours of care every day. Also, there are some recreational activities for elders in the community center in your area. The social worker can help you to find and reach out to them.
Thank you so much, Rena, for meeting and spending time with my family and finding the solutions to our concerns. Your help is really appreciated.
You are very welcome. Here are some flyers with important information about Alzheimer's and some contact information that can assist you further.
Now that we already know and met the Candid family and their problem, let's further discuss. First, we will show you the genogram of the Candid family. Here is the legend to better understand their genogram. Here is the Candid family genogram, which shows the 3 generational diagrams. The 3 generation includes the grandparents, parents, and the children. We have also indicated in the genogram the medical conditions and the health behaviors of each of the family members. We want to emphasize the health problems and risk factors related to Mrs. Rose's condition. Next is the ECMAP diagram of the Candid family. Here is the legend to further understand the ECMAP of the Candid family. Now, here is the Candid family ECMAP. The diagrams show different factors that directly and indirectly affect each member of the family. The arrow indicates which or who in the family are the most affected by Mrs. Rose's condition and has the most responsibility in taking care of her mother, her husband, the children, along with her part-time job. We want to point out which among these factors can help the family. Therapeutic communications. It is one of the important components to effective, quality, productive, and successful outcomes during family interviews and interaction, and is crucial in establishing a therapeutic relationship. According to the College of Nurses of Ontario, 2019, nurses need to use their caring attitudes and behaviors, professional knowledge, communication skills, and competence in maintaining and building a therapeutic relationship with the patient and their family in order to provide the best quality and safe care, patient satisfaction, and improved health outcomes. In patient and family-centered care, we assist and encourage them to take an active participatory role in their own care and in decision-making. We are present to guide, support, and advocate for what is best for them. Lastly, we need to respect, be sensitive, and give importance to the family beliefs, values, culture, and religion. We may also need to incorporate all of this during our working interaction with the family and may assist them in attaining a quality life and enhancing their well-being. We need to provide constant support to the family and follow up as necessary. Now we will be discussing the 5 therapeutic questions that we used for the Candid family. First is, Would you like to share your feelings when your mother Rose was diagnosed with Alzheimer's disease? How did your family members react to Rose's illness? This will be helpful in clarifying the feelings, reactions, and emotional aspects of each of the family members. Second is, how do you manage or balance your time in taking care of your mother, your family, and yourself? This will identify the appropriate support and interventions each family member may need. Third is, how are your children coping and dealing with the family situation in their everyday routine? This question will be helpful in clarifying how their children are adapting to the new changes in their everyday lives. Number 4. Can you tell me more about how you feel in relation to your stress as the primary caregiver of your mother and having no time for your family? This will be helpful to know the concerns, weaknesses, challenges, and/or most pressing issues that she may be facing in this current situation of their family. The last question is, how can our professional team better help you and your family when it comes to your needs and preferences? This will be helpful in establishing rapport and increasing collaboration with each family member and the nurse. It will also allow them to take an active participatory role in their care and help to clarify their expectations. The Candid family didn't have considerable problems before Rose's accident, and they lived happily. But after diagnosing Rose has Alzheimer's disease, it affects the patient and the entire family. The benefits of taking the medication may be limited and may pose serious risks. Because when the patient was given antipsychotic drugs, it may increase the risk of death. This incident affected the individual emotions of each member, including anger, fear, frustration, and sadness. All family members have to support Rose and they have to allocate time for her. Due to this condition, their roles and responsibilities are changed. Most of the time Anne has to become a caregiver. She suffers a lot, and she is more stressed. She has more work such as caring for Rose, preparing meals and all household works, providing needs of 3 children and caring for them and working on her husband. Due to all kinds of work she can miss some work. Psychosocial considerations may be particularly efficacious for agitation and other behavioral symptoms, because even when these patients have become cognitively impaired, because they may remain remarkably responsive to interactions with other people. Bayes to Hopper, T.L., 2003. The first is to recommend the family to counseling services. The counseling services are needed, and she needs help from someone. The nurse can link her to the social worker and other services as needed. Secondly is to refer the family to psychological support. The family is experiencing a wide range of emotions. Both Anne and Mike are always exhausted and tired. The nurse can assess and address the problem of each family member. The nurses can link the family for child counselors too. Religious activities may also help the family to divert and enlighten the problem that they are facing. If the nurse initially assesses the family well, she can identify the strengths of the family and their needs. Making shared decisions with family members will help to find the solution for those challenges. According to Wright and Leahy 2013, commendations were first described in the family systems as the interventive action of drawing forth and highlighting previously unobserved, forgotten, or unspoken family strengths, competencies, and resources. Commendation is a type of intervention conducted by nurses to empower patients and families to enhance the formation and maintenance of a collaborative relationship with patients and family members. By praising the family's expertise and strength and offering them a new opinion of themselves, a context for change may be created that allows families to discover their own solutions to problems. Commendations allow families to celebrate their own courage, wisdom, and success. Number 1. Commitment. The Candid family is committed to taking care of Mrs. Rose. Nurses can help the Candid family to promote welfare and happiness within the family through balancing relationships, sharing responsibilities, not overcommitting to activities outside the home, and setting common goals. Anne takes all her mother's care duties, looking after her children, husband, and other housework. Angeline is accommodating, and can ask her about others, such as picking up groceries or driving Mrs. Rose to her appointment. Number 2. Appreciation and affection. Anne needs counseling and emotional support as she is distressed regarding her mother's condition. She needs to recognize a positive and constructive atmosphere to enhance personal self-worth. Number 3. Positive communication. Nurses can arrange to meet with all family members to listen and discuss all family issues and suggest solutions according to the situation. The emotional burden of the diagnosis can overwhelm the family. The nurse can educate Anne and her family about Alzheimer's disease and its effects on Mrs. Rose's memory. Also, educate them on how to redirect Mrs. Rose regarding time, date, and in any situation. Nursing interventions include allowing the Candid family to express their concerns individually about the present condition. It will help them to vent their feelings. Number 4. Enjoyable time together. Anne's family used to spend time with each other on weekends. But, after Mrs. Rose was diagnosed with AD, everyone in the family got affected emotionally and mentally. A nurse can educate them to spend time together while cooking, doing household chores, or spending some time outside. Through this, the nurse can enhance relationships and establish family identities. Number 5. The ability to cope with stress and crisis. A nurse can communicate well, add humor to the situation, and keep things in perspective to unite the family in difficult situations. Mrs. Rose walks slowly, needs assistance with activities of daily living, and has started wandering, increased forgetfulness, and is disoriented. Nurses can educate all family members how to help Mrs. Rose to make her day easy. Lastly is the plan of care for the Candid family. Our diagnosis for the Candid family is: increasing Alzheimer's disease results in unrecognizable hazards in the environment. We identify 2 family systems strengths that support our plan of care for the family. First is that the practitioners carefully engage the family to establish a strong partnership between the family and the program that is recommended for the patient. The second is to refer to social support that could help to watch for Mrs. Rose. We formulated 3 goals for the family and clinician. Number 1. Mrs. Rose will remain safe from environmental hazards resulting from cognitive impairment with no complications or injuries obtained. Number 2. Closely monitoring of Mrs. Rose's pills and regular checkups. Number 3. Companionship and social support for Mrs. Rose. We prepare different interventions that are appropriate and will help the Candid family. We started by formulating preventions. The first is to assess the family's needs. This is to establish the program and intervention for Mrs. Rose. Also is to connect the family to the Alzheimer's support group. Next is the action that we are planning to imply for the family. Number 1 is to eliminate or minimize sources of hazards in the environment. Because a free hazard environment allows maximum patient independence and a sense of autonomy. Next is to instruct the family to remove or lock up sharp objects and cabinets. This is to help in preventing physical injuries such as ingestion, burns, overdoses, or accidents. Number 3 is to instruct the family to cover electrical outlets, thermostats, and stove knobs. This is to help in preventing accidental injury and or electrocution. Number 4 is to instruct the family to maintain clear pathways, remove all small rugs, unnecessary objects on the floor, make sure all the furniture is against the wall. Beds and chairs should have no wheels or always lock them, if with wheels. This is to prevent tripping or falls. Number 5 is to instruct the family to keep the door and windows locked. This will help to ensure safety for patients who wander. Also, we would like to recommend to the family that Mrs. Rose must be wearing some form of identification, especially when she's outside. This will help in identification in case Mrs. Rose gets lost from her caregiver. Always keeping adequate lighting is important to help Mrs. Rose to see and find her way around the house without having an injury. It is important too that Mrs. Rose should not be left unattended at all times to prevent accidents to happen again. Lastly, we will assist the family to seek financial support from the government to provide care for Mrs. Rose. Financial support can help the family to hire a care provider and substitute/alternate to look over for Mrs. Rose sometimes in a day so she can do her job and watch for her own family too. The final part of our plan of care for the family is the outcomes, evaluation, and replanning. Evaluation will be done once the plan is being implemented. This is the end of our group presentation. We thank you for watching and listening.